Hello, we're talking with Joel Gilbertson. He is the Senior Vice President of Community Partnerships with Providence St. Joseph Health. And today we're going to be talking about what the future of healthcare looks like. Hi, Joel. Thanks for coming in.
Thanks for having me.
Tell me a little bit about your job.
So I serve as the head of community partnerships for Providence St. Joseph Health. Providence St. Joseph Health is a ministry that's been serving in the West now for almost 170 years. Started by groups of sisters, St. Joseph of Orange and Sisters of Providence, who came west really to meet needs, which back then included everything from caring for orphans to healthcare needs, educational needs. Now we primarily are a healthcare organization in the West, continuing to focus on the poor and vulnerable. And in my job, what I get to do is what I call the fun stuff. And to be honest, I think it's something that, to me, is what's special about Providence St. Joseph Health, is acknowledging that not all the good you do and not all you do to improve healthcare happens within the four walls of hospitals. There's a lot you really can do working out into the community, so I get to lead that work. That includes working with government. How do we build partnerships with government to pursue public policies that help people live better, live healthier, improve our communities? We also lead our community health investment programs, which is where we work with not-for-profit partners and other organizations into the community. Last year we delivered $1.6 billion of community benefits, so those are programs into the community across the spectrum.
Now, when you say delivered community benefits, what do you mean?
So community benefit is really where we say we're a not-for-profit organization, and so we need to return value back to our community, really to demonstrate that benefit that we're providing. What we focus on, we are a healthcare organization, so some portion of that is free and discounted care, and making sure that people who are uninsured or underinsured can get the services that they need. But it's also about making specific investments. Some of those are grants or programs we operate into the community. They can be everything from health education, clinics for certain diseases, chronic diseases that individuals are suffering from, maybe research, other community building programs. It's a pretty broad portfolio.
And it's expensive as well, so there's a lot of philanthropy, I assume.
It is, and that's another thing we do within community partnerships. We're building partnerships with government, we're building partnerships with nonprofits, but we're also building partnerships with donors. Philanthropy's been in the DNA of the organization from its start. I look at the Sisters of Providence. When they first came west, they would send sisters by mule into mining villages all across the Northwest, trying to fundraise for the services they offer. That still continues to this day, and we've been blessed to have donors in our communities who are connected to the mission, believe in the services, want to improve the health of their communities. And so to this day, we're still looking at ways in which we can attract funds to support outreach to poor and vulnerable populations.
And this may be a little bit of a sidebar, but I've always been fascinated about what causes a philanthropist to be a philanthropist.
Well, I think obviously it's individuals who have both the capacity to give, but a generous spirit in it. And then I think it's also about how do you connect individuals and their passions to big ideas. Because I think most people want to know not just that they're giving money, but it's going towards things that are truly making society better, or truly making their community better, or serving a population they really care about.
Which is what you guys do.
Which is what we do. And so, for some donors, they are very passionate about making sure people have access to care. Maybe it's cancer care or supportive services while people are going through cancer care. For others, they want to cure cancer. And so I think you see donors that are both focusing on the provision of services, caring for certain populations, but you also have some folks who are looking at ways in which we can start advancing curative health care.
Now, do people contact you, or do you contact them, or is it a bit of both? I mean, how do you find people who want to give and people who care about the community?
Well, the most important thing is that fundraising is local. And so there are philanthropic foundations that are part of Providence St. Joseph Health that are geographically focused on supporting their local healthcare institutions, and all of them have boards. And these are not employees. These are individuals from that community who care deeply about healthcare, care deeply about having a strong healthcare system in their community and caring for their neighbors. And so it's those boards locally that really lead this work. And some of that work is reaching out and trying to, connect with the larger community, and in some cases it's events, very different ways you can engage the community and support local healthcare.
I really never thought about a lot of philanthropy and when it came to healthcare until I met everyone at Providence St. Joseph Health. It seems like you guys are doing an amazing job out there. It's like this is in your DNA.
Yeah. One, it's vital for healthcare to really thrive in this day and age we're in right now, to find ways that you can not just provide the care, but find ways to make sure that care can get better every year.
Right.
The reality is healthcare equipment is very expensive. Healthcare services are very expensive. Many people can't afford healthcare. We've had, from our start to this day, an attitude that whoever shows up at our organization's doors will be cared for regardless of their ability to pay. And that does require us to find ways to generate the funds to make sure we're meeting their needs.
Right.
Right now, you look at most of the public insurance programs, which are wonderful programs for insuring people, whether it's Medicare or Medicaid, but those insurance programs don't actually cover the actual cost of caring for individuals, even who have those insurance options. So you've got to look for different ways to make sure that you have the resources in place so that those services can be relied on over time.
And that's what you do with community partnerships.
We both look at ways in which we can generate the resources and bring together passionate donors to make sure we can provide services, but we're also reaching out and operationalizing the programs ourselves. As I shared, we have programs into the community. Many of them are philanthropically supported. Some of them are financed through other structures, but it's an ecosystem you have to make sure you have at that local level. What we've known from the get-go is that you really can't address healthcare in a community on your own.
Right.
You've got to build partnerships, and that means partnering with government, that means partnering with donors, but it also means partnering with other nonprofits, and in some cases, investing in other nonprofits, strengthening them, helping them succeed, really lifts all boats. So it's not just about ourselves.
So it has to be strategic, and you have a Health 2.0 strategic plan. What's that about?
Yeah. Historically, I think most healthcare organizations have been focused on healthcare,
right.
Which is people present needing to have services delivered to them to address their acute or chronic healthcare needs. And the infrastructure in place says, we'll take care of you. We'll have the doctors, we'll have the hospitals to meet your needs. What we know going forward is that's really not going to be sustainable. And you see that right now. You see the number of people who can't afford health insurance, they can't afford the care they're receiving. You really have to break away from the incremental improvement of the legacy models and think about healthcare differently. And so one was going to Health 2.0, not healthcare, Health 2.0. And that means we've got to focus on the upstream investments into things that impact the amount of services people will need over time, ways we can keep people healthy, thinking about a broader constellation of services. So it's not just the hospital, it's not just the medical clinic, but it's also about how do you use data better, how do you engage people digitally, how do you build local healthcare services, how do you build even fitness and wellness programs. Really thinking about Health 2.0 as this next generation of healthcare, focusing on the individual, enabling them digitally and through supportive services, and then making sure the ecosystem really works well so that people are healthier, can live longer, and ideally not receive the same amount of services they had before.
So this will, in fact, lower healthcare costs?
Absolutely. It has to. Right now, healthcare is costing north of 18% of GDP.
Wow.
So almost $1 out of every $5 flowing through our economy right now is being consumed by healthcare. You're seeing an aging population. You have 10,000 individuals a day are aging into the Medicare program. You don't have as many workers in the workforce right now to support programs for individuals who are now retired as you had a couple decades ago. There is really no path forward for healthcare to be vibrant unless you're finding ways to keep people healthier, helping people use the right services at the right level, and then finding ways to distribute those costs equitably. And that type of disruption is necessary so that I don't think anyone wants to wake up and find out on January 1 their healthcare premiums went up 23%.
Right. Yeah. And how does your team tie into this plan, the Health 2.0?
We're focused significantly on moving forward with programs and services that reach out into the community and help people maintain healthier lives. And sometimes that's working with really fragile populations. So an example would be we have a lot of waste in healthcare, and it's good waste in the sense of someone had their needs met, but it's waste in the sense it could have been met better at a lower cost and with them receiving less, a more holistic service for them. And an example of that is you look at the individuals who are frequently coming into our emergency rooms.
Right.
These individuals might be uninsured, they might be homeless, that might be dealing with a significant mental illness or some other behavioral health concern. It might be substance abuse. You can continue to treat that person who is uninsured in your emergency room, which costs a lot of money, is meeting their needs a little bit. Or you can take a portion of that money and invest that into the community. And you can say, maybe we need to have better housing solutions. Maybe we need to have behavioral health clinicians in the primary care clinics. Maybe we should make it easier for some of these individuals to get into primary care services. And through those investments, which are pennies on the dollar compared to what it costs to treat someone in the emergency room, you're able to get people into stable housing, you're able to meet their healthcare needs, and those types of investments really are essential to Health 2.0, and those are the things that my team works on.
You guys are on the cutting edge of healthcare, it seems to me, and it looks like you're working really hard to bring the cost down, like we just discussed. What do you see in the future? I mean, how do you see this working out?
Well, there's a lot in that question. I think there's questions around what's going to be the policy environment for healthcare going forward. The United States is still one of the outliers amongst developed countries in terms of the role of government in healthcare and how individuals procure healthcare coverage. And then you have the tremendous change that's going on within the industry itself. Significant disruption because of the improvement in technologies, but also the challenges associated with the amount of data that's available in healthcare and how you can manage care better. I think what you're going to see going forward is that healthcare systems are going to be focused on how do you deliver care at a more personal level, which may mean a little bit back to the future about having care in the home more, including clinicians reaching out and caring for people where they are. You're going to see, because of advances in science, more personalized medicine. Data and analytics allow us to target therapies differently and also look at what's the most effective treatment for an individual. And then I think as a collective, you're going to see continued economic pressure on healthcare providers, and those that are able to make this leap and really strengthen the healthcare of their communities are ones who can make a leap, and to be able to bring together a delivery model that's sustainable, because the other side of the ledger, how you pay for it and public policy, I think for the foreseeable future we're looking at an environment where you're going to see continued challenges in terms of the ability of people to access healthcare coverage, and then how much your insurance companies are willing to pay for healthcare services. And that's I think one of the reasons why innovation is which is in our DNA, is so needed right now.
You mentioned economic considerations. One of the considerations is you need to be able to pay great doctors the amount of money that they want to be paid or need to be paid. Are we going to continue to be able to do that?
I think as a society, I don't think we can't be paying more than 18% of GDP right now for healthcare. I think as a society, we all owe.
So everybody has to take a part in this.
I've got kids in public school. I think most individuals realize that we have a lot of things we need government to do. We need to fix the potholes in the roads. We need to educate the next generation of citizens. We need to have great healthcare as well. And all of these things are tapping into kind of a finite resource, which is how much society can really pay for these things. So yeah, we have to drive these costs down. It has to get done for this to be sustainable going forward.
You're not just another guy working for Providence St. Joseph Health, and I don't mean to be disrespectful when I say another guy, because there are a lot of really talented people, but tell us a little bit about your background.
Yeah. So I've worked on most sides of healthcare. I've worked in public policy at the national level. Worked with a member of the Senate Finance Committee working on healthcare policy, Medicare, Medicaid, everything that was under the Social Security Act. I was blessed to be able to run a state health and social service agency, running Medicaid programs, but really seeing that you can't think about the services individual needs around programs. You have to understand the broad continuum of ways individuals need supports. So that included everything from a juvenile justice system to a child protection system to public health infrastructure at the state level, which was really a great opportunity to see how you have to have all of the components of healthcare aligned, from public health to acute care medicine to a policy environment for example, around health insurance, to really have vibrant healthcare. And then went on to operations. Spent 5 years in healthcare operations, running hospitals and medical clinics, And it was a few years ago that I was invited to come to our parent organization's offices and start thinking about how you get an organization of our scale. 118,000 caregivers spread across 7 states. How do you get an organization of that scale to align all of its resources at the community level to pursue this Health 2.0 strategy?
Well, you have seen both sides.
Right.
Do both sides understand each other?
Not well. I think the reality is there is a constant need to find simple solutions. And the reality is that there isn't a simple solution to solve healthcare's problems. I think government is really well designed to address things in kind of one-year increments. Healthcare itself, too, I think can sometimes find itself stuck in one-year increments around how do you budget for the next year, and how do you make sure you have the capacity to meet needs over the next year.
But healthcare is evolving much more than the government is evolving, right?
I would say right now, yes. And I think that is not necessarily a compliment to either side. I think that the disruption and transformation needs to move faster within health organizations, and the policy needs to move with it. And obviously, when those don't move together, that can be a problem. But if you want to really change, it's one of the real challenges you have in healthcare is, we're all, our health insurers think about us in annual increments.
Right.
What's it going to cost to cover this person for the next year, and how many services are they going to use in average across this big actuarially defined population? And that's an interesting way to think about it, but the reality is a lot of the investments that are going to impact your health 10 years from now, 20 years from now, may take investments now. And that's one of the real problems you run into is if you want the value of that investment to be realized in that year, it causes you to focus on certain things. If you realize that making investments today, whether that's helping people to be able to manage their diabetes better, or helping individuals maintain a healthy body weight and avoid obesity and diabetes over time, those are investments you make now that may not bear fruit for 5, 10, 15 years. And health insurance companies aren't really set up to make investments now and realize value 10, 15 years down the road. And that's why I think one of the other big changes you're going to be seeing over the next couple of years is that really deepening, you're already seeing it now with some announcements at the national level, deepening that connection between how we pay for healthcare and how we offer and deliver healthcare. Those have to become more integrated because we have to kind of disrupt this short-term thinking about investments. And one of the things I'm blessed to be able to work on is at the community level, focusing on those investments that will bear great fruit, but it may take 4 or 5 years for them to really be realized.
Well, we've talked about disruption. Is Providence St. Joseph Health a disruptor?
I would say yes, significantly so. I think both in terms of the maturity of how we look at investments into the community and thinking about ways in which we track the value of those investments into certain populations. But I also think the ways in which we're embracing technology. We're blessed to have a digital innovation group that's in-house that's focusing on developing
I've spoken to them.
different ways to engage the consumer. And the reality is that when you find ways to engage individuals where they are, might be where they are in understanding the importance of health to themselves. It may be physically where they are, and maybe where they are in terms of language. When you can engage people where they are, you can actually impact individuals' lives and make healthcare more affordable for all of us.
Providence St. Joseph Health talks about health for a better world. What does that mean?
Well, I think which I mentioned earlier, is saying it's health, not healthcare.
Right.
And I think there's a lot into health. I mean, I think about health being allowing people to achieve their full potential. And there's a lot of things that go into impacting health. And they're not just things you deliver within the 4 walls of a healthcare infrastructure. Education impacts healthcare. Economic vitality impacts health status. Public policies impact health status. So one, it's thinking about the broad set of activities that we do as an organization, but then also acknowledging that we are part of a world, an interconnected society globally. And it's our job to make sure we're improving lives everywhere. 2 other components within the community partnership teams that I lead is we actually have a university and a college of health professions and a college of liberal arts and sciences. So we're still focusing on education and how do you develop the future caregivers and future workforce, but also helping to support those individuals in developing personal economic success. And we're also engaged with international ministries. So we still have a very vibrant global presence. We right now provide services into a number of countries around the globe, and significant investments into Guatemala right now, focusing on working with underserved populations and how do you really create great learning for us, but great impact globally in the pursuit of health for all.
In your job, do you find yourself having to educate the public, patients, and others about how healthcare is changing, and to maybe have them reassess their view of healthcare? I mean, because a lot of people think you go to the doctor, like you were talking about the four walls, you get something to prevent something, and then you move on, or get something to cure something. But I mean, as we've been discussing, it's a lot different than that.
The answer is yes, at both a personal and a societal level. So we do lead advocacy for organization. This organization, like many organizations, has a voice. We can express things at the national level, even at the state level. And so we've been focusing on trying to bring forward public policies that bring to life the types of changes we want to see in terms of access, or how the services that are offered, or what's covered, with a belief beneath it that healthcare is a basic human right. But we're also focusing on education at the individual level. And so that means working with health education, for example. A lot of opportunities sit with especially with immigrant populations, working with communities that are largely underserved and underrepresented. How do you help them understand how to navigate what is a tough healthcare system to navigate, even if you have my experiences, have worked in the system, understand healthcare very well? You find out tomorrow you have someone in your family who's been diagnosed with something. The first thing you're doing is picking up the phone, trying to get someone else to help you to figure out how to navigate the system. And healthcare literacy and healthcare navigation is an important component, because it's when you get people into those interactions with caregivers, that's when you can start to implement different life changes that can truly improve individuals' health.
Are there enough doctors coming into this business that can serve other communities, that speak all the languages? Are you having any problems with that?
Access is a big problem, and there's access at the top line level, but then when you dig into it, it really is. There's a number of things at play. One is we still struggle to find clinicians with certain specialties. Behavioral health is a perfect example. Tremendous need for behavioral health, and by and large, if you find out that you have either yourself or someone in your family needs behavioral health services, and you go immediately to see who's available, who's accepting new patients in my community, you'll find across the country a real shortfall. And so we have shortages. But I think what also is important to say is that it's not just at that physician level. In fact, going forward, if you want to deliver healthcare at a lower price point, we also have to get what we refer to internally as getting everyone to work at the top of their license. So right now you have a lot of physicians out there that are treating coughs and colds and other things. And it really, if you think about how expensive it is to deliver healthcare, one portion of how you make healthcare more affordable and more accessible is getting your physicians to be able to spend their time on those patients who uniquely need the services of a physician, but then also expanding the amount of additional professionals, be they physician
PAs,
assistants or nurse practitioners, to extend the access with the talents that they have, and then also thinking about the ways in which you can use even less complex trained professionals for certain things. And all of that is part of the workforce shortage and why we launched a College of Health Professions.
And nurse practitioners and PAs, I don't think a lot of people really understand what they do. So you have some education ahead for that than for the public, right?
Yeah, I think it's interesting. You find people who have received services from a nurse practitioner or a physician assistant. That's all they want, unless of course they need very complex healthcare services. And depending on your geography, if you're in a rural area right now, you're probably used to seeing a physician assistant or a nurse practitioner. You're used to how we've had to try to find ways to have coverage for healthcare services in rural areas. I worked up in Alaska, of all places, where in some of the rural areas you didn't even have a nurse practitioner or a physician assistant. You were being treated by a community health aide in very rural areas. But the reality is these are really well-trained, talented healthcare professionals who can meet those primary care healthcare needs and do it with really great access for individuals. And then you're also seeing the other disruption that's occurring right now, which is a significant amount of healthcare in that primary care setting really moving to urgent care or moving to retail clinics. And you can't drive a block these days and not find a drugstore that also has a healthcare professional with a clinic in there.
That's true.
And I think this gets back to one thing healthcare has to be better at, and it ties into the comments around serving people where they are. The reality is picking up and lugging yourself into a doctor's office is incredibly inconvenient. No other industry would have built something that is so inconvenient to the consumer. And while healthcare probably has a lot of reasons where it got where it is right now, it needs to become more consumer friendly. And this is another reason why community partnerships gets involved in these things. A lot of times you hear people talk about serving individuals in their community or at the local level, and you forget that how hard it is for a person who is an hourly worker who has to take time off from work and gather up the kids and go off to a physician office somewhere. It's incredibly expensive, and it's incredibly impactful on those individuals to receive health care. And through some of these investments, looking at ways in which we can care for people, sometimes digitally through your smartphone or at home.
Yeah, that's amazing.
It's a great way not just to meet people's healthcare needs, but also support them in their own economic success.
Yeah, recently I've been able to get an appointment from a PA or a nurse practitioner over the phone.
Right.
And that's just, so you do a lot of that too.
Yeah, we're probably going on almost a decade of being able to make a restaurant reservation on our phone. We're now finally able to celebrate in healthcare that we're making it that easy. And the surprising thing is, now that we've implemented those types of things, that's considered novel. Because there is still a large portion of healthcare out there that right now doesn't even have that. And I think the challenge for us is not just being best amongst our peers, but really getting these services to be at the level that a consumer should expect.
Are there any stories that stand out in your mind that you'd like to share with us?
Well, I think, as I think about things that we do within Providence that I kind of recharge myself off of, one of those is our work into Guatemala. We're doing right now in the Central Highlands in an area called Chicaman, where we, in this upcoming year, based on carrying forward where we are right now, we're going to have about 350 caregivers from our organization who will be volunteering their time to travel to Guatemala and to make public health investments, and also looking at ways of expanding surgical services into that country. And that, to me, is a real important reminder of just that volunteerism spirit that sits within the organization, and our job within community partnerships to find ways for people to serve into the community. And then also to think about some of the unique ways all our organizations trying to meet needs. And one of the ones I was really heartened to learn more about and to support is work we're doing in one of our communities in Spokane, Washington, actually, where they were dealing with the fact that, and you're seeing this all across the country, this tremendous growth in the homeless population. And within that growth in the homeless population, you have individuals with chronic conditions. And for a number of individuals, they end up hospitalized. Their healthcare needs were met in the hospital at that moment, but then they're discharged with care instructions and ways they should be taking care of themselves post-discharge, but returning back onto the streets only to see their health status deteriorate again. And one of the projects I've been really amazed by, and now we're looking at how we scale that more rapidly across the organization, was establishing a respite program for individuals that are homeless. So individuals who are being discharged from the hospital, we now have worked with a local partner at the community level to find a housing solution, beds, where we can discharge people to, provide them temporary housing until they can get back up on their feet and have their post-discharge healthcare needs met. And I think that's an example of how no insurance company's paying you for that. No one's there's no reimbursement for it. But doing that treated those individuals with a level of dignity they deserve, but is also helping them get back on their feet and not end up back in a hospital because they weren't able to care for themselves. Wow. Those are great stories in action and things that we have to continue to grow.
You seem really passionate about healthcare. Is that accurate?
I'm passionate about communities.
Right.
Well,
I mean, passionate about what you're doing, though.
Yeah, I love healthcare. I am not a healthcare clinician. This organization was smart enough not to let me actually touch anyone in what they serve. But I am really proud of being in an organization that lets you think about how you help people live better lives. When I worked in government, I was always focusing on programs that helped people become more independent, being able to support themselves, being able to thrive, and now being within healthcare. There's this constant reminder that if we're just meeting short-term healthcare needs, we're missing out on the way in which, in each encounter, and in how we shape our programs, we can help people live better lives. And I'm passionate about that.
Well, that's great. Joel Gilbertson, thank you very much for joining me. I appreciate it.
Thank you for letting me join you.
Talk to you again.
Talk soon.